Have you ever felt this way? You wake up in the morning, stretch gently, and that familiar ache settles deep into your lower back. It's not sharp, but it lingers, almost like a shadow that follows you through the day. You may have changed your pillow, tried new exercises, or even told yourself it's just part of getting older. Yet something inside you wonders why the pain never fully goes away. One of my patients once shared a story that stayed with me for years. She had been living with chronic back pain for almost a decade. She tried physical therapy, she tried massage, she tried heat packs and pain medication. Nothing brought lasting relief. When she finally came in for a full evaluation, we ran a simple blood test, and the results surprised both of us. Her vitamin D level was extremely low. After just a few weeks of proper supplementation, her back pain began to fade in a way she hadn't experienced in years. She looked at me with tears in her eyes and said, "All this time, I had no idea it could be something so small." I want you to imagine this. Your bones, your muscles, and even your nerves move together like an orchestra. When vitamin D is plentiful, the movements are smooth and strong. But when your vitamin D is low, everything becomes slightly off balance. The bones become less supported, the muscles fatigue more easily, the nerves become a bit more sensitive. The entire system works harder than it should, and the strain often shows up exactly where most older adults feel it first: the lower back. In the world of Senior Health Daily, we often talk about posture, movement, and joint wear. But many people don't realize that vitamin D acts like a quiet foundation beneath all of those factors. Without it, even the smallest tasks can create discomfort. Today, we're going to explore this overlooked link between back pain and vitamin D deficiency. And by the end of our time together, you'll understand your body in a way that brings clarity, confidence, and hope. As we begin this deeper conversation together, I want you to settle into a comfortable space. Take a soft breath and imagine you and I are sitting across from each other in a quiet room. The kind of room where sunlight warms the floor and time feels a little slower. That's how I want this part of our journey to feel. Gentle, clear, and full of understanding about what your body has been trying to tell you. Let's start with something many people never realize. Vitamin D is not just another nutrient on a nutrition label. It's more like a silent conductor guiding your bones, muscles, and nerves to work in harmony. When vitamin D is plentiful, your body moves with strength and balance, but when it's low, the entire system struggles quietly beneath the surface, and one of the first places that struggle shows up is your lower back. I want to take you back to a moment from early in my practice. A man named Robert came in complaining about persistent lower back pain that he described as deep and exhausting. He explained that it wasn't the kind of pain that stabbed or shot down his leg. Instead, it felt like a constant weight pressing into his spine, especially when he walked for more than a few minutes. He had tried stretches, chiropractic adjustments, even a new mattress. Nothing helped. When we checked his vitamin D level, it was lower than I expected for a man his age. After 6 weeks of steady vitamin D supplementation, he walked into my office with a straighter posture and a softer expression. "It feels like someone turned the volume down on my pain," he said. Stories like Robert's are far more common than most people know. Vitamin D deficiency is incredibly widespread, especially in older adults living in the United States. Many seniors get less sunlight than they used to, whether because of health conditions, mobility issues, or simply spending more time indoors. And as the skin ages, its ability to produce vitamin D naturally decreases. That means even if you walk outside daily, your body may not be producing enough to meet its needs. But why does this lead to back pain? The answer is beautifully simple and surprisingly profound. Vitamin D is essential for calcium absorption, and calcium is the mineral that gives bones their strength. Without enough vitamin D, your bones become weaker, softer, and more sensitive to pressure. This condition, known as osteomalacia in adults, often starts subtly. A person might feel mild discomfort in their spine, especially after standing or walking. Over time, the discomfort grows into a deeper, more persistent ache that doesn't respond well to traditional back pain treatments. Just as important is vitamin D's role in supporting muscle strength. Your spine is protected by layers of muscles that act like supportive pillars. When these muscles are strong, they hold the spine upright and reduce the strain on joints, discs, and ligaments. But when vitamin D is low, muscles become weaker and tire more easily. This creates a chain reaction. The core muscles relax too quickly. The lower back takes on more weight than it should. The nerves surrounding the spine become more sensitive, and before long, you're dealing with a constant ache that seems to follow you everywhere. One of the most overlooked consequences of vitamin D deficiency is increased inflammation. Vitamin D helps regulate how the immune system responds to stress, injury, and irritation. When vitamin D is low, the body becomes more reactive. Small irritations in the spine feel bigger. Minor problems feel heavier. A simple day of light activity can make your back feel like it worked twice as hard. It's important to know that back pain from vitamin D deficiency has a very particular personality. It tends to be dull, deep, and persistent rather than sharp or explosive. Many patients describe it as a pressure or heaviness in their lower back. Some say it feels like their spine is tired. Others describe a slow-burning ache that seems to grow stronger in the late afternoon. These descriptions tell me immediately that we're dealing with something more systemic than a pulled muscle or irritated nerve. When you understand the body this way, it becomes easier to see how interconnected everything truly is. A deficiency in one vitamin can ripple outward, affecting bones, muscles, nerves, and even mood. That's why so many older adults with low vitamin D also report fatigue, sadness, or difficulty concentrating. The body doesn't suffer in isolated parts. It feels things as a whole. In the next section, we'll go even deeper into how vitamin D deficiency alters the harmony of your musculoskeletal system and how your back becomes the first place where the imbalance shows itself. Understanding this connection is like turning on the light in a room you've been walking through in the dark. You suddenly see what you've been bumping into, and once you can see it, you can finally begin to change it. As we move a little deeper into this topic, I want you to picture your spine not as a single structure, but as a living partnership between bones, muscles, joints, discs, and nerves. Every part depends on the others. When one piece becomes weak or unbalanced, the entire system begins to shift. And that shift is often where discomfort begins. Vitamin D plays a quiet but powerful role in keeping that partnership stable. When your vitamin D level drops, the imbalance can spread through your body like a quiet ripple until it reaches your lower back, where it finally becomes loud enough for you to notice. One thing many of my older patients find surprising is that vitamin D deficiency doesn't always show itself immediately. It grows slowly, almost invisibly. You may go months or even years with low vitamin D without realizing it. But behind the scenes, your body has been compensating. Your bones have been borrowing minerals they shouldn't need to borrow. Your muscles have been working harder than they were meant to work. And your nerves have been carrying stress they were never designed to hold. Eventually, the strain breaks through the surface, and back pain becomes the warning sign. I remember a patient named Carol who came to see me after months of feeling like her lower back was getting progressively weaker. She told me she felt as if her spine was melting under pressure, even though she had done nothing to injure it. She was healthy, active, and careful with her posture. But every time she stood for more than a few minutes, the discomfort grew until she had to sit down. She felt confused and discouraged. When we checked her vitamin D level, it was astonishingly low. After 3 months of steady supplementation and gentle strengthening exercises, she came back smiling and said, "It feels like someone put the strength back into my bones." Her story reflects a pattern I see over and over again. Vitamin D deficiency changes the way your musculoskeletal system behaves. One of the most important roles of vitamin D is helping your body absorb calcium. Without vitamin D, calcium simply passes through your digestive system with little benefit. That means even if you drink milk or take calcium supplements, your bones might not be receiving what they need. And when bones don't get enough calcium, they become softer and more sensitive to movement and pressure. This is why people with low vitamin D often describe their back pain as a deep ache that feels like it's coming from inside the bones rather than from the muscles or joints. Another significant effect of vitamin D deficiency is how it weakens the muscles that support your spine. The muscles of your core, hips, and lower back act like scaffolding that helps keep your posture strong and your movements steady. When these muscles are weak, your spine has to carry more responsibility. It begins to sag, compress, and strain in subtle but damaging ways. Over time, this can lead to chronic lower back pain, even in people who are otherwise active and healthy. I often tell my patients that muscles are like loyal friends. They work hard for you, they stay by your side through every season of your life, and they protect you even when you're not aware of it. But they also need the right nourishment to stay strong. Vitamin D is one of those essential nutrients that keep muscles functioning properly. When it's low, muscles fatigue faster. They recover more slowly, they contract less efficiently, and all of this adds extra stress to the spine. Another hidden effect of vitamin D deficiency is its influence on inflammation. Low vitamin D levels are associated with higher inflammation throughout the body. That doesn't mean the kind of inflammation you can see or feel on the skin. It's deeper and more subtle, almost like a quiet swelling inside your tissues. This increased sensitivity means that even small problems in your spine can feel larger and more painful than they truly are. It's like turning up the volume on a speaker. The signal may be the same, but the experience becomes louder. I want you to imagine your spine as a bridge. When the bridge is well supported, strong, and flexible, it carries the load of daily life without issue. But if one pillar becomes weak, the entire structure becomes stressed, even if the weakness is not immediately noticeable. Low vitamin D is like that weakened pillar. The bridge might not collapse, but it becomes less stable, more sensitive, and more prone to discomfort. And because the lower back carries the weight of your entire upper body, it's often the first place where the imbalance reveals itself. One of the most fascinating things about vitamin D deficiency is how it can overlap with other common age-related issues. For example, some people think they have sciatica, when in reality, their nerves are simply more sensitive because of low vitamin D. Others believe their discs are degenerating rapidly, when actually their muscles are too weak to properly support those discs. And some assume their posture is the problem, when the real issue is that their bones are carrying more stress than they were designed to handle. Understanding this connection gives you the ability to respond with clarity, rather than relying on guesswork. Back pain is a complex puzzle, but vitamin D deficiency is one piece that many people overlook. In the next section, we're going to explore the specific signs that your back pain may actually be connected to low vitamin D levels. These signs are subtle at first, but once you recognize them, they become unmistakable. And when you understand what your body is truly telling you, you gain power. Power to respond, power to heal, and power to live with more freedom and less fear. As we continue this journey, I want you to lean in a little closer and pay attention to the quiet signals your body may have been sending for months or even years. When it comes to vitamin D deficiency, the signs often whisper before they shout. Many older adults don't realize they're deficient until the pain becomes steady enough to interrupt daily life. But if you know what to look for, the clues become surprisingly clear. Let's start with one of the earliest signs, a deep, almost internal ache in your lower back. This isn't the sharp pinch you might feel when you move the wrong way or the lightning-like sensation of nerve compression. Instead, it feels as though the pain sits inside the bones themselves. Many patients describe it like a weight or a heaviness that doesn't quite go away, even when they rest. This type of discomfort is often a sign that the bones and muscles are working harder than they should because they're not receiving the nourishment vitamin D provides. I once had a patient named Helen who told me that her lower back felt tired, even on days when she hadn't done anything strenuous. She described it perfectly. When vitamin D is low, the spine often feels tired because the muscles that support it fatigue more quickly. Over time, this leads to a cycle of weakness and soreness that becomes easy to overlook. Helen assumed her discomfort was simply part of aging, but after a simple blood test and a consistent vitamin D routine, the fatigue she carried in her back gradually lifted. She told me it felt as if her spine woke up again. Another sign that often goes unnoticed is pain triggered by standing or walking for extended periods. People with vitamin D deficiency frequently feel as though their lower back starts complaining earlier than it should. Even a short trip to the grocery store becomes uncomfortable. Standing in line feels exhausting, and walking around the house starts to feel like work rather than a natural movement. This happens because the muscles surrounding your spine lose endurance when vitamin D is low. They struggle to hold the spine upright and stable, especially under prolonged strain. There is also something deeply telling about the timing of the pain. Many older adults with low vitamin D feel worse toward the afternoon or evening. As the day progresses and the muscles tire, the discomfort grows. Imagine a lamp with a fading battery. It still works, but the light becomes dimmer, softer, less steady. Your muscles behave the same way when they aren't supported by adequate vitamin D. They lose stamina, and your lower back becomes the first place to reveal it. One of the more surprising signs of vitamin D deficiency is an increased sensitivity to pressure. Patients sometimes tell me that lying on their back feels uncomfortable, even on a soft mattress. Others report that gentle pressure on the spine or hips feels unusually tender. This sensitivity comes from both weaker bones and heightened nerve reactivity. Vitamin D plays a role in calming inflammation and regulating how nerves respond to stress. When levels are low, the nerves become more reactive, which means sensations that should feel mild begin to feel exaggerated. Fatigue is another important sign, though it may not seem connected to back pain at first. When your body is low in vitamin D, your energy levels drop. You may find yourself feeling tired, even after a full night's rest. This fatigue makes it harder for your muscles to perform, which then increases pressure on the spine. It becomes a cycle: tired body, weak muscles, strained back, more pain. Many older adults assume this is simply what aging feels like, but often it's a correctable deficiency quietly sapping their strength. Sleep disturbances also tend to accompany low vitamin D levels. If you find yourself tossing and turning, waking up feeling unrested, or struggling with light sleep, your body might be lacking the support it needs to repair tissues during the night. When sleep quality is poor, the spine doesn't recover fully from the day before. Over time, this leads to accumulating discomfort in the lower back. Mood changes can be another clue. Vitamin D deficiency has been linked to feelings of sadness, irritability, or emotional heaviness. This emotional layer can make physical discomfort feel even more intense. When the mind feels weighed down, the body often mirrors that weight. Many older adults living with chronic back pain don't realize that part of what they're feeling may be tied to a vitamin deficiency rather than mental or emotional strain. And then there's the posture effect. When vitamin D is low, the muscles that maintain posture become weaker and less coordinated. Without realizing it, you may start leaning slightly forward or shifting your weight unevenly. These small compensations add up, creating new pressure points along the spine and deepening the discomfort. Sometimes correcting vitamin D levels helps people stand taller and move with more natural alignment, reducing the stress on their lower back. As you reflect on these signs, you might begin to see patterns in your own experience. Perhaps your back pain has felt deeper, more persistent, or more tiring than expected. Maybe you've noticed your muscles feeling weaker or your energy lower than usual. These aren't random symptoms, they're messages. And when you learn to interpret them, your body becomes a storyteller instead of a mystery. In our next section, we'll explore what you can do to confirm whether vitamin D deficiency is contributing to your back pain and what steps you can take to restore balance. You'll learn the importance of testing, how to supplement safely, and how simple lifestyle changes can support your spine in ways you may not have realized before. Knowledge is the beginning of healing, and you are already on that path. As we enter this final part of our deeper discussion, I want you to take a breath and recognize something important. Your body is not working against you. Even when you're in pain, even when your back feels heavy or tired, your body is always trying to guide you toward balance. Vitamin D deficiency may be a quiet disruptor, but once you understand it, you can take meaningful steps to restore strength, stability, and comfort. One of the first and most powerful steps is simply getting clarity. If your back pain feels deep, persistent, or strangely tied to fatigue and weakness, a vitamin D test can provide answers you may not have expected. The test is simple. A small blood sample measures your 25-hydroxyvitamin D level, which tells you exactly where you stand. Many of my older patients were stunned when they saw their numbers. Some were far below what their bodies needed to function well. Others were just slightly low, yet even that small deficiency was enough to create discomfort. Knowledge is empowering. When you know your level, you know your next step. Once you have that clarity, the path forward becomes much more hopeful. Supplementation is one of the most effective ways to restore vitamin D levels. It doesn't require dramatic changes or complicated routines. Consistency is the real key. Many people start noticing a shift within a few weeks, not because the supplement works like a painkiller, but because it gradually fills the gaps their bodies have been struggling with. The bones become better supported, the muscles regain strength, the nerves calm, and over time, the heaviness in the lower back begins to ease. But supplementation is only one part of the picture. Sunlight remains one of the most natural and gentle ways to boost vitamin D. I often tell my patients to step outside during the softer hours of the day when the light feels warm but not harsh. Just 10 to 20 minutes can help the body generate vitamin D more efficiently. Some people like to pair this time with a slow walk or gentle stretching. It becomes not only a moment of nourishment, but also a moment of peace. A small ritual that supports both physical and emotional well-being. Food also plays a role in restoring balance. While no single meal will fix a deficiency, choosing foods rich in vitamin D can support your overall effort. Fatty fish like salmon, fortified milk, eggs, and mushrooms all carry small but valuable amounts. Think of them as quiet helpers working alongside your body as it rebuilds. What I've found over the years is that healing from vitamin D deficiency is rarely just about the numbers. It's about the lifestyle that grows around those numbers. The more you care for your bones and muscles, the more responsive your spine becomes. Gentle movement is especially powerful. When your back pain has been caused or worsened by low vitamin D, the right exercises can act like a reassuring hand placed gently on your spine, telling it that support is returning. Simple movements such as controlled core engagement, slow hip stretches, or mindful walking help strengthen the muscles that stabilize your lower back. They don't need to be intense. They don't need to be lengthy. They just need to be consistent. Strength grows quietly, the same way deficiency does. But this time, it grows in your favor. One of the most overlooked aspects of healing is how you speak to yourself during the process. I've met many older adults who blame themselves, believing they should be stronger or tougher or more resilient. But pain is not a sign of weakness. It's a sign of imbalance. And imbalance is something that can be corrected with patience and understanding. When you recognize that your pain may be tied to something as correctable as vitamin D levels, the frustration softens. Hope returns. And hope is one of the most powerful forms of medicine we have. Another thing I want you to remember is that the spine responds beautifully to alignment. When your vitamin D levels begin improving, pairing that improvement with better posture can create remarkable changes. Sitting tall, walking with gentle awareness, avoiding long periods of stillness, or shifting your weight evenly when standing can reduce strain on your spine. When your body receives vitamin D, it becomes easier for your muscles to support these healthier patterns. What I love most about this topic is that it gives people a sense of possibility. Vitamin D deficiency is common, but it is also repairable. It doesn't require complicated procedures or invasive interventions. Sometimes the most meaningful improvements in your health begin with the smallest steps. A little sunlight, a consistent supplement, a gentle walk, a new awareness of what your body has been trying to say. As we prepare to move into the final part of this video, I want you to hold on to this thought. Your back pain is not a random burden. It has a story. And now you understand a part of that story that many people never learn. In the final section, we'll bring everything together and reflect on how knowledge, patience, and gratitude for your body can guide you toward a stronger, more comfortable, and more confident life. As we come to the end of our time together, I want you to pause for a moment and acknowledge something truly meaningful. Your body has been speaking to you all along. Every ache, every wave of fatigue, every moment your lower back felt heavier than it should have been was not a sign of failure. It was a gentle call for attention. And today, you took the time to listen. Back pain can feel overwhelming, especially when it becomes part of your daily life. But understanding the connection between your discomfort and something as correctable as vitamin D deficiency is a reminder of just how resilient the body truly is. Healing doesn't always require dramatic interventions. Sometimes it begins with a small shift, a new awareness, or a simple act of nourishment. And sometimes it begins with believing that your body can restore itself when you give it the support it needs. I've seen remarkable changes happen when people embrace this belief. Strength returns, energy rises, pain that once felt permanent begins to soften. And with each small improvement, confidence grows. That is the power of patience, the power of consistency, and the power of honoring your body instead of fighting against it. So as you move forward, I want you to carry this thought in your heart. Your body is not your enemy. It is your lifelong companion. It responds to care, it responds to kindness, and it responds to hope. Every day offers you another chance to choose those things. Thank you for spending this time with me today. If this message brought you clarity or comfort, I invite you to continue this journey with us here at Senior Health Daily. Together, we'll keep learning, healing, and discovering the strength that has been within you all along.